Now, another very powerful feature of right-clicking on a stack of images like this is you can also open all of them. Right now, over here in this lower right-hand corner, it says 6 X-rays. That means we have 6 of them stacked on this one position. And if we click on this little tab here that says View Images, what it will do is it'll launch the database for this given patient. Now, the database could have 50, 60, 70, some odd, any number of images in it, but what it will do is it'll launch the database and only show the 6 that are on this position. And you then have the opportunity to highlight 1 or 2 or all of them and load them into the image processing screen so you can see them all. So we're going to do that right now. I hit View Images, and there are the 6 images that I just stacked on that one position, and by selecting all of them, I'm just clicking on each and hitting load, we then get all 6 in our image processing screen. So this is a way that you can bring the client over on the side and say, here's the sequence that we did for a root canal, or for whatever other reason you may want to have all of the radiographs put on one particular position associated with a given patient to be shown all at one time. So this is a very powerful feature. If I close all of these, I can then drag and drop these images. I want to make sure I'm at the top of the stack here. Back to their corresponding positions. Another useful feature of ProImage is its ability to attach comments to individual radiographs. For instance, if I select this position here, and I can always unselect all just to make sure I have nothing first and then select it, I then have the ability to come down here and add a comment. Now if I select this tooth, there is no comment yet attached to it. If I go back to this one, we now have the comment. So I can select this tooth now and add a comment to it. So, as you can see, every single radiograph can have a comment added to it, and even if we have a stack, for instance, I'll take this and stack it on top of that one. I can now put a comment on here, A, and then that's the bottom, and then go to the top, select that, and go B. And when I bring this one up, I have A, and this one, and select it, I have B. So it'll even follow the teeth within a stack. No problem. Okay, so if we close out this template and we go to the database, if I go up to this particular tooth here and I select it, notice we have the comment has followed it into the database, so it's attached to it. So we don't even need, we lose our position on the template down in the database. However, we can do a lot of searches using all kinds of different search criteria. We have at our disposal all of the images associated with any one patient here in the database. You have the ability to change the patients. It's a pretty powerful section of the program. And if I go to this selection, notice I now have the different comment on that one. So I'm going to exit and go back to the chart. Now I'm going to randomly select a few of these and load them. by hitting View Selected Images. Now we have all of these tools up here, including the Clarify and the Gamma, which are two of the more sophisticated and powerful tools in the program. The Gamma is basically a mid-range contrast stretching tool, which essentially darkens in a very sophisticated manner. I'm going to take this image, which has some light areas, and I click on Gamma once. Notice how it darkened up. It's a beautiful tool, especially for underexposures. The Clarify is very similar to Unsharp Mask in Photoshop, and essentially it is finding boundaries, periodontal ligaments, that sort of thing, and enhancing them. To show this Clarify tool, I might come down to this one and click it once, and notice how it has a little bit of noise introduced into it, but it's also allows boundaries to pop out a bit more. If I click too many times, I ruin the image. But this brings up in the Edit drop-down menu the ability to undo, and the undo is actually a history, which is really very, very nice. You now have the choice of going back to wherever you want, this being the original. You can double click on it and it's back in, essentially with no changes at all. If we go to close all images, it says there are images that have been modified and not saved. Do you want to save the changes? If you say yes, which in many cases you will, because you've done changes that have enhanced the image and you want to save them that way, it will do that, but it will not overwrite the original. What it will do is it will copy that modified image into a modified images folder on your hard drive or the external drive, wherever you're saving all of these, the database, wherever you have the database located. And you will always have the ability to go back and look at the original image. And to do that, you access that from the template. I'm going to show you that in just a moment. So I'm going to say no to saving that, and we're back into the template here. And now any modified images that may be on this template, if you want to see nothing but originals, clicking on this, Show Original Images, will allow that. So if there were any modified images, they're not showing now. But when we close the template and come back in, the modified images will be the ones that come up. So I'm going to select 4 images again and load them. And here we have the spotlight. When I turn the spotlight on, I come down to the active image, which is this one here with the blue bar. This is great. This pops out. It's an exaggerated auto contrast. It's a bit noisy, but it is temporary. It's not permanent. Like that one a lot. We have mouse, contrast and brightness. We have brightness one way, we have contrast the other. And we have invert. These are probably the most useful tools, the ones that I see people using the most. And you can also call up the original image right here as well. You're not in the template, but you can bring back the original image here as well. So these are some of the enhancements. Under annotations, you have all kinds of things that you can draw. Ellipses, notes, put sticky notes, text, all kinds of different annotations on the image, but in order to save them, you have to do just that. You have to save the image. When you close it, you'll be prompted to save it or not. So we'll close all of these images, and I'm going to say no to saving. And here we are back in the template. So far, we've been loading multiple images into the image processing screen. But if you would like to load a single image, it's very easy. You select the image, such as this one here, double-click on it, and it's loaded. By double-clicking one more time, you get a full screen image, and by double-clicking again, you are back to the image processing screen. And by hitting Close All Images, that brings you back to the template.